Hi, I'm Ashley, and this is my patient Michael. Okay, first, you can lay down on your back. We're going to be testing active range of motion of knee flexion. So, normal range of motion is around 140. So I'm going to be placing the fulcrum on the lateral epicondyle of the femur. Just relax. The stationary arm is going to be lining up with the greater trochanter of the femur. Okay. And then the moving arm is going to be, here, extend all the way down, lined up with the lateral malleolus of the fibula. So we are starting out about 180 degrees, and then I'm going to have you bring your heel up to your bottom. So I'm going to realign those, and then we're ending at about 40 degrees, which is exactly 140. And then I'm going to do the same thing on the other side. Starting at 180 here, and then same thing, flexing your knee all the way up. Realigning. And then we're ending at about 45 degrees here. So we're about 135 degrees of flexion, which is within normal ranges. Next, I'm going to be performing the passive range of motion for tibiofemoral medial glide. So I'm going to have the knee flexed to about 25 degrees. My stabilizing hand is going to be on the medial femur. My other hand will be on the lateral tibia. And I'm going to apply passive medial pressure. And I feel soft infeel, which is normal. Do the same thing on the other side, flexing to 25 degrees, stabilizing the medial femur, applying medial pressure, and I feel same thing on the other side. And any movement would indicate a medial injury. Next, I'm going to be performing the Noble's test to test for ITB compression syndrome. So I'm going to move the knee and the hip to 90 degrees. And I'm going to apply pressure over the ITB. I'm going to maintain that pressure and slowly extend down. And if he felt pain, that would be a positive test. And that pain would typically be felt around 30 degrees of flexion. And I'm going to do the same thing on the other side. So flexing to 90 and 90, applying that pressure, and then slowly moving down to extension. Next, I'm going to be performing grade 4 manual muscle test for hip extension. So first I'm going to stabilize the pelvis at the iliac crest, and then I'm going to have you extend your leg up off the table, and I'm going to apply minimal force. Okay. This is assessing the hamstrings. And then I'm going to do the same thing on the other side, stabilizing, and then have you extend your leg. So if he is able to perform that without his muscles giving down, then that would be a pass for that manual muscle test. And then if I wanted to assess more of the gluteus maximus instead of the hamstring, I would perform the same thing, but with the knee bent to relax the distal tendons. So I'm gonna have you do the same thing. You're gonna lift your leg up off the table and apply a small amount of force, okay? And then I'm gonna do the same thing on the other side. Bending that knee. You can relax your leg into my hand. And then extend that leg up, okay? So he passed both of these grades. I'm gonna be performing the Trendelenburg special test. It has a specificity of 92 and a sensitivity of 61. It's testing for glute med weakness, and the non-weight bearing side is the side being tested. So first I'm going to have you lift one leg off the ground. And I'm looking for his ASIS to become unequal or uneven, and then do the other side. And he is staying even, so that is a negative test. So I'm going to be performing the posterior drawer test in 3 different directions: neutral, internal, and external rotation. So first I'm going to bend that knee to 90 degrees, and his hip is going to be in 45-degree flexion. Going to sit on top of his foot. Going to wrap my fingers around his posterior tibia and place my fingers on the joint line. And then I'm going to apply a posterior force. And if his knee moved back or it felt soft or squishy, that would be a positive test. Next, I'm going to move his foot into internal rotation, and I'm going to perform the same test. And then moving it into external rotation, and the same thing. So he tested negative on this side, and then I'm going to compare bilaterally. So first in neutral. And that knee is not moving. Next, moving into internal rotation. Then into external. And that knee is not moving in any of the directions. So that would be a negative test on both, and the sensitivity for this test is 90, and the specificity is 99. First, I'm going to be laying down on your stomach. And I'm going to be palpating for the PSIS. So I'm going to find the top of the iliac crest and then go a little medial until I feel the 2 bumps. Next, I'm going to be palpating for the vastus medialis oblique. So it is the medial aspect of the rectus femoris. So I'm going to have you flex your foot right here. And then it is this part right here. And then I'm going to compare bilaterally. So same thing on this side. And it is right here.